Okay, so let's talk about beta blockers. Now, beta blockers are antihypertensive medications, and the idea is they bring down the blood pressure. Okay, um, but it would be silly to talk about just beta blockers in this video because well, you'll see why by the end of this video. But beta blockers are another name for them is beta, and I'm not going to spell the whole thing out here, but beta adrenergic antagonists. Okay. Beta blockers and beta adrenergic antagonists are the same thing. There's something opposite of antagonist, and that would, of course, be an agonist. So a beta adrenergic agonist it does the opposite. Okay. So you have two types of beta receptors. You have beta 1, which are cardiac receptors, and you have beta 2, which are respiratory receptors. So let's kind of draw a little receptor here. And they have to be activated by something. Something has to activate these receptors, otherwise they won't do anything. And there's different things that can activate them. For the most part, it would be like epinephrine, norepinephrine, isoproterenol. And in case you're wondering what the difference is between these, epinephrine, norepinephrine, isoproterenol are almost, if you ever looked at the chemical structure of them, they're almost identical. They're almost exactly the same. So don't get hung up what the big differences are between them. They all do the same thing for the most part. You know, we can go back a step further now and ask ourselves, well, what causes our body to release epinephrine or norepinephrine or isoproterenol? Lots of different things, and we could use stress as an example. Stress, like fear, if you're scared of something, you see a bear, that would make you fearful. What else? You know, exercise, and all of this will make sense in a second. But let's talk about the effects that happen when cardiac receptors are activated or respiratory receptors are activated. So starting with beta 1 receptors, when they're activated, two main things happen. Number one, blood pressure increases, and number two, the heart rate increases. Okay. Um, the main thing that happens when beta 2 receptors are activated is the airway will dilate, and that can be good. It can be good because we want the airway to dilate in certain conditions, such as patients who have asthma. We want the airway to widen so they can breathe better. And that would be an example here of the beta adrenergic agonist. Okay, so what this is saying, a beta adrenergic agonist causes this to happen. It causes these, and let me make this clear too. These receptors, beta 1 and beta 2, they happen together. If one's activated, the other one's activated. Are there drugs out there that work selectively on one and not the other? Yes, there are. But for the most part, most of the drugs work on both. They'll activate both, okay, or they'll block both of them. So beta adrenergic agonists, and let me give you an example of this. Albuterol, which is the rescue inhaler, is a beta adrenergic agonist. Okay, and so it causes this process to happen. But the advantage or the reason that we're doing this is because it increases or it widens or dilates the airway, which is good because they can breathe better. But the side effects to it then are the increased blood pressure and the pulse. Increased heart rate and the blood pressure, of course, we don't want to happen, but it's because they're both being activated. That's why it happens. Okay, so now if we're doing the opposite of this, we're blocking this whole process from happening. The reason we're blocking it is because, well, it would be a beta blocker, a beta adrenergic antagonist, And we're blocking this from happening because we want the blood pressure to decrease, which is good because it'll bring our blood pressure down or bring our heart rate down. But the other thing is it has the opposite effect. Instead of widening the airway or dilating it, it will constrict the airway. So beta blockers, for that reason, aren't used with asthmatic patients, and if they are, it's because the benefits outweigh the risks. But for the most part, beta blockers are not used with patients who have asthma. Um, so what else did I want to add on here? Oh, just so you know, a little side note. Most beta blockers end in LOL. One nurse told me that she remembers beta blockers because they end in LOL, and LOL is like lots of laughs or laugh out loud or whatever it stands for, and that's funny like a beta fish because they're funny looking. I guess I don't know. I never thought beta fish were really funny looking, but I guess to her they are. So that's cool. Whatever helps you memorize it. Um, but but anyway, with beta blockers, I think it's clear now that if you're blocking this from happening, you the whole purpose of it is to decrease the blood pressure and decrease the pulse. But anytime you're doing that, you run the risk of decreasing the heart rate or the blood pressure too much. So that's why before giving a beta blocker specifically, compared to any other antihypertensives, you need to know a blood pressure and a pulse before you give it. And that way, if heart rate does decrease or blood pressure does decrease, you have something to compare it to. And you know, you usually take it before. You're not going to take a heart rate and blood pressure after necessarily, unless they're symptomatic. So hopefully that clears it up and it makes it a little more understandable for you. And I think that's about all I have.